Hi, it's Mel from NMC OSCE and I'm here today to go through the implementation station. So this is a 15-minute station and I am given a scenario and the implementation scenario says I'm to give all G medications for 12 o'clock. So I'm going to practice my medicine management skills and give all the medications that's safe to give my patients. So to save time and stop you getting bored with this video, I'm going to pretend that I've introduced myself to the patient, I've completed a 3-way ID check, and I've found out that my patient is allergic to codeine, and that's been written on my chart, and my patient has also in pain. So I've checked all the adjusted graphs on my chart, that's been completed, I've established that he's allergic to codeine and that he's in pain, and we're going to proceed, okay? So, oh, and the time is, sorry, not 12 o'clock, it's 1600 hours, and I'm going to give all the G medication for that time, okay? So, the first page just tells me of my patient's allergy. I've already confirmed that. It's written in, it's got the right reaction. I can see that he's on ward 12, his consultant is Welsh. He is 5'10" and he weighs 85 kilos. He's not on any special diet. When I move over to the once only doses or stat medications, I can see that he has already had paracetamol. He had 1 gram and it went via the IV route at 2 o'clock. And presume that's the bag that's hanging. I'm going to check that in a minute and check his IV site. So he's already had paracetamol, and he also had it earlier today because he's not on any oxygen, as you can see in my chart. But if you look further down on the PRN or as required medications, he also had some paracetamol earlier today at 6 o'clock. He had it orally that time. So I'm going to turn over my page. Now we've established there's no PRN or stat drugs due. I'm going to check on my antimicrobials. And my patient is charted for amoxicillin. So I'm just looking at it. He has 500 milligrams. He's written for it TDS. It's going the oral route. It's for 7 days duration. And there's a problem with this drug. It's not been signed by a doctor, so it's not a legal prescription and I can't give it. So I'm just going to code it straight away, so I definitely don't give it when I go back to potting my medications. So I'm going to code it as a number 6 because it has been wrongly prescribed. It's an incomplete prescription. And I'm going to go to the back of my MAR charts and I'm going to write the time is 1600 hours. It's today's date. The drug is amoxicillin and it's an incomplete prescription. I'm going to sign it and I'm going to write my name in a printed form. I'm then going to go back to my charts. So we've established I can't give you amoxicillin. I'm now going to go into my regular medication. So the first regular medication David is prescribed for is furosemide. He's written for 40 milligrams. He's having it twice a day. He had it very early this morning. He's due it now at this time. It's going orally. It's continuous. It's started today. And it's an ongoing prescription, it's signed by a doctor, so it meets all the rights of medication. I've got the right person, I've got the right route, I've got the right drug, the right time, and it's the right frequency. So I'm happy for him to have it. Just one thing I want to check. Can I ask if my patient's blood pressure is okay? Is it within normal limits?
Yes.
Great, okay, so he's not hypervolemic or anything and his blood pressure is within normal range, so I'm happy to give it. So I'm just going to dot this. I'm moving on to my next medication, is cocodamol. I'm not happy to give cocodamol because as well as containing paracetamol, cocodamol contains codeine and my patient is allergic to codeine. So I am not going to even read through the rest of this prescription, I'm just going to code it, okay? It's 2. Code 2 for a clinical reason. I'm now going to go back into my back of my charts and I'm going to write down cocodamol. and it's 4 o'clock, it's today, and I'm going to not give it because of allergy. I've signed for it and I've printed my signature. So that's completed, so the nurse that comes next will have full knowledge of the reason why I didn't administer this medication. The next medication on my regular medications is atorvastatin. I'm not going to give this because it's just not due yet. He's having it later tonight, so that's his Lipitor. And the next medication I've got is levothyroxine. That's normally given in the morning, but obviously David likes it at this time, so I'm going to give it at this time if that's regular for him. Do you normally have your levothyroxine at this time, David?
Yes, I do.
So I'm going to give it to him. So he's written for 100 micrograms, which is an appropriate dose for him, once daily. It's written continuous prescription orally. Oh, it's to start tomorrow. So I can't give it now because it's not due. I'm going to speak to the prescriber though and make sure that if he needs it today, because he needs it every day, that this medication's given. Okay, so I do have to chat to the prescriber anyway about this chart, because there's medications that are charted that he's allergic to and ones that aren't signed for. So this is not a medication I can give. I'm not going to code it, it's just not due yet. So I'm just going to get out the medicines I can, which is only one. So I'll put my drug chart up here so it's easy for me to see what I'm doing. And I'm going to give some furosemide. So this is my furosemide bottle. It's for David Smith, so it's for the right patient, and it's free flowing, it's in date, and it expires in the future, and it's 20 milligrams per tablet. So I want a 40 milligram dose, so I want 2 tablets. So I'm going to get my medication pot. I'm going to 2 tablets in the lid without touching them, using non-touch technique. I'm going to put this back into the locked cabinet, lock it later. I'm going to turn around to my patient, and I'm happy that it's safe to give because his blood pressure's okay, it's due medication, all the rights of medication have been met, but I just need to get informed consent from him before I give it. Hi David, how are you?
I'm fine.
Okay, I've got your water tablets here, it's the furosemide. It helps you with it. Your ankles are quite swollen, aren't they?
Yes.
Right, so it helps with reducing that swelling, because if you're retaining water, it helps you pass it. It can make you dizzy if you take it, can drop your blood pressure. But do you normally take it?
Yes.
You don't have any problems with it?
No.
Okay. I'm going to give it you now. Is that okay?
Okay.
And use the buzzer if you need to go to the toilet or you want any help going to the toilet. Is that okay?
Okay.
So I'm going to give my patient, I'm happy that I've got informed consent. I'm going to give my patient the medication. I'm going to offer him some water to drink it, but obviously he can't drink it because he's a mannequin. I'm now going to sign for the medication. It's been given. And I am going to close the cabinet. I'm going to lock the cabinet because it's a drug trolley. I'm going to keep it safe. And I'm going to speak to the prescriber about some pain medication as well, because this gentleman's in pain, but I can't give the medication because it's got codeine in it, and also some medications are wrongly prescribed or he's actually allergic to them. So that is the implementation station. Okay, if you enjoyed this video or found it helpful, great news. Please follow me on Facebook and my YouTube channel, or call the WhatsApp group. I'll put the number below if you're watching on YouTube. Okay, bye.